Hello everybody, my name is Carlene and I am the owner and occupational therapist at Mobile Rehab. And for the last 3 years, I have partnered with Florida Gulf Coast University, where we have been conducting research on neurodegeneration and falls and balance. Our research actually started just in the Parkinson's population, and we've been extremely successful and blessed to be well received by the community. Last few presentations we've done, I've had a lot of people contact me and reach out about exercises and things that they can be doing to help get ahead of the loss that we're doing research on and associating with, and how they can be more involved in their care and their recovery and those type of things. So we've actually put together an exercise routine and some trainings for you today that we're going to provide to the Parkinson's Association so that you can get started. And we're also letting you know that we're about to start our third round of research with Florida Gulf Coast University. And if you're interested in that, please reach out to our company or FGCU and let them know that you'd love to be part of the next round of research. Now I'm going to hand you over to our awesome group of 4 students who've been working really hard at preparing this for you.
On this slide are the activities we are going to demonstrate throughout this presentation. We will introduce how to perform each one and what should be avoided. Our first activity are towel scrunches. The purpose of towel scrunches is to activate and engage the toe flexors. Performing towel scrunches can assist with appropriate weight distribution and enforce an engagement of the toes during functional movement to promote safe interactions within the environment. To do this, a towel will be placed under your feet and you will try to squeeze the towel using your toes. We aren't looking for you to pick up the towel if you're unable to. The main goal is to activate our toe flexors to practice keeping them engaged when we perform functional transfers and various functional activities. What we want to avoid during this activity is putting our toes in the air or extending the toes, especially after releasing the scrunch. As you release the towel from underneath your toes, you want to maintain that toe engagement with the towel the entire time. Our next activity are towel slides. Similar to towel scrunches, slides will promote and encourage proper muscle activation and consistent foot and toe engagement with the floor when performing functional tasks. It helps to promote proper weight shifting that can help improve balance and coordination and increase safer interactions within the environment. When performing, we want to sit closer to the edge of the chair with the towel under 1 foot. We will begin with the foot closer to the chair and slowly slide your foot further away from the chair. Go until you feel your toes are about to come off the floor and slide your foot back. When sliding back, try avoid lifting your heel off of the floor. Your toes and heels should never leave the floor. You can imagine you are trying to lift the towel up similar to the scrunches if it assists with keeping toes flexed and engaged. We want to avoid quick movements as our intentions are also to activate those smaller muscles that have not been utilized often. We also want to avoid toe flaring and coming off the floor when sliding that foot out, and avoid bringing your heel off of the floor when bringing your foot back in. Our next activity are sit-to-stands. Sit-to-stands assist with proper weight shifting and activation of the appropriate muscles when performing functional transfers, such as with different chairs, cars, and various furniture throughout your home and your community. When performing sit-to-stands, bring your feet closer to the chair, and of course, use your armrests if you have them to guide your sit-to-stands. Bring your chest over your toes, but maintain your eyes forward and do not look down. Engage your toes with the floor and slowly stand all the way up while looking forward and toes staying in the floor. Slowly sit back down, maintaining toe engagement with the floor and a forward gaze. Again, as you're standing, we want you to keep your toes engaged with the floor, and we want this activity to be performed slowly while both standing and sitting. With this activity, we want to avoid having your toes raised up when standing from the chair. This is what leads us to falling backwards as we put our weight into our heels. Although you might not fall back each time, having those toes flare does not appropriately allow us to weight shift properly and activate those smaller muscles that help guide our functional movements. We also want to avoid leaning far forward. Leaning far forward reinforces our weight to be pulled down, which, if you think of it as where you look, you go, this can lead to an increased fall risk. Think of picking something out in the distance to maintain eye contact with, and imagine a string is in the middle of your head pulling you up nice and tall. We want you to stand all the way up before sitting back down. Our next activity is forward dynamic balance. The purpose of this activity is to engage proper postural muscles and appropriate weight shifting. This assists with weight shifting when performing functional tasks. For example, if you are placing an item in an overhead cupboard, or even when bringing your arms overhead when putting on a shirt or sweatshirt, we want you to be able to perform those activities safely and efficiently. When performing this exercise, we want you to begin with your arms beside us if you're not using weights, or you can hold your arms slightly in front with either a weight or a dumbbell, for example, or a broomstick. You are going to raise your arms slowly until you are overhead. When beginning, your weight should be evenly distributed in your feet, and as you begin to raise your arms, your weight should start shifting towards your heels and be fully on your heels when your arms are straight in front of you at shoulder height. As you continue to raise them, your weight should begin shifting towards the toes or balls of your feet and should be fully there when your weight and arms are completely overhead. We want to avoid having your toes come off of the floor. We often see this if trying to move quickly, as we aren't engaging and activating the appropriate smaller muscles, and if we are moving at our hips versus weight shifting. With that being said, we want to avoid movement at our hips, such as pushing them back or forward. Our hips should maintain alignment with the rest of our body. The weight shifting is coming from our feet, and our body is swaying with it as one whole unit. Additionally, sometimes we can do this activity with no loss of balance and our posture looks good. However, we won't be weight shifting. Our knees will be locked, and although there is no loss of balance during this activity, it will not reinforce the concept of unlocked knees and allowing for a natural sway to reduce rigidity in our functional movements. Our next activity is lateral dynamic balance. The purpose of this activity is to engage proper postural muscles and appropriate weight shifting to translate into functional tasks. Think of it as if you were going to grab a gallon of milk out of the fridge. When we reach forward, it is important to have our weight shift backwards to counterbalance our arms and upper body weight moving forward. Otherwise, you will topple forward because that is where your weight is going. When performing this exercise, we want to begin with both arms in front of you, which means your weight will be on those heels. From here, you will slowly move your arms into a T while shifting your weight from your heels to the balls or toes of your feet. Think about bringing your belly button into your spine and squeezing your shoulder blades together to place extra emphasis on those postural muscles as well. With many of our activities, we want to avoid the pulling of our head forward and down. When performing, we want to keep postural alignment and engage those upper back muscles, bringing the shoulder blades together. This will help increase safe interactions with the environment and also strengthen those postural and core muscles. Similar to forward dynamic balance, we want to avoid movement at the hip to try to elicit weight shifting. Our hips should maintain alignment with the rest of our body, and the weight shift should occur as a unit, beginning at those feet and ankles. As we weight shift, the bottom of our feet should maintain contact with the floor, even when our weight is shifting forward to our toes and balls of the feet or backwards to those heels. We want to avoid lifting those toes or heels off of the floor, regardless of where the majority of our weight is when performing this activity. Our final activity is our staggered weight shift. The purpose of this activity is to reinforce the idea of naturally catching our weight versus stiffening and locking out our knees. This is incredibly important, especially if we lose our balance or footing and need to take a step back or forwards. Catching our weight with unlocked knees and proper body mechanics can decrease the risk of falls and increase our safe interactions with the environment. To perform this activity, take a step forward and allow some space between your forward and backward leg. Keeping your hips facing forward and posture upright with your knees unlocked, move as one unit to shift your weight forward, moving onto the balls, toes of your front foot, and then shift backwards, unlocking that back knee even further and shifting your weight towards the heel of your back foot. When performing this activity, your feet should maintain contact with the floor the entire time, and think about maintaining eye contact with an item in front of you to reinforce your upright posture. Common areas we see difficulties with during this activity is unlocking of the knees. We want to avoid keeping those knees locked, as that is reinforcing that lack of natural movement during functional mobility. We recommend holding onto a bar, countertop, or other surface for support. However, be sure to use it as a guide and allow your hand to slide with you as you move forward or backwards. Otherwise, your torso will lean in the direction of your hand. We also want to avoid lifting our toes off of the floor, especially when shifting our weight to the backwards leg. Doing this will potentially lead to us having to take an additional step backwards or multiple steps backwards and not having proper balance and coordination when trying to catch ourselves from a potential fall. If the staggered stance is a bit more challenging, consider performing a step through. You would still begin with a staggered stance and push off your toes of your back foot and step through as you do a heel to toe strike. Your weight should shift towards your toes and ball of your foot as you finalize that step through. As you bring your foot back, you will perform a toe to heel strike, and the weight should shift towards your heels. Similar to the staggered stance, you will want to avoid raising your toes, lean in posture forward, unaligned hip motion, and locking of the knees. We hope this presentation can assist you in performing activities that will help promote activation of smaller muscles and postural and core muscles, and improve your balance, coordination, body awareness, and function while decreasing your risk of falls and increasing safe interactions with the environment. If you have any questions, please reach out to Mobile Rehab. If you are interested in participating in our research, feel free to reach out to either Mobile Rehab or FGCU. Thank you for watching.